Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Wael Saasouh and Lisa Scardina. Thanks for joining us today, Wael and Lisa.
Thank you, Kim.
Good to be here.
I'm glad to have you. And by way of a very brief introduction, because I want the two of you to do all the talking, I will say that Wael shares on his tagline that he's a family man, a board-certified anesthesiologist, researcher, and aspiring innovator. And Lisa is the Chief of Brand and Partner Development at Provider Solutions and Development, and she's on the executive team and the traction team for Medicine Forward. And today we'll be talking about burnout, rust out, and moral injury at all levels, affecting not only clinicians, but students, residents, nurses, ancillary staff, and administrators, and pushing productivity versus appreciating shortage and value, and the role of AI and technology, and reasons for hope, some inspiring initiatives. So we'll see how far we get. It's a lot to tackle, but I know Lisa is a taskmaster when it comes to this, so we'll get it done. So how I always start is I like to ask what you'd most like our audience to know about you as we begin our conversation, and feel free to include any hobbies. Wael, would you like to go first?
Sure, thank you. I'm Wael Saasouh. I initially did my medical school and anesthesia training back home in Lebanon, the country, and worked there for a couple of years, then moved to the States, tried to get into anesthesia again, obviously to get board certified. So I had to do a couple of fellowships, redo residency, then start working as an anesthesiologist. Got married back home, moved here with my wife. Then we had our two daughters here. They're 1 and 3 now. And on the side of my clinical work, if there is such a thing, I do a lot of clinical research, and I try as much as possible to maintain some hobbies like martial arts. I have my own company. I try to do some keyboard. I play music. Try to teach my kids. Trying to maintain some sanity in this chaos that we live in.
Yeah, that's amazing. Thanks for sharing that. Lisa, what would you like us to know about you?
Sure. I'm Lisa Scardina. I'm based in Portland, Oregon, and Kim, through your masterful networking of putting these conversations together, I love that Wael is from the Detroit area. That's where I was born and raised, but I've been out on the West Coast for about 30 years now, and have spent the last 20 years with the Providence Health System and working in healthcare, working for and with physicians. I just have I think about that idea about know your why. And somewhere along the way in my career, I maybe didn't know it early on, but I came to find it working in healthcare really from a position of having a particular lens on the physician and provider experience has really turned into my why. In my current role with physician provider solutions and development, it really is thinking about physician supply and demand and what that physician environment is really like out there, and the reality for our country around all of that. And so if I can do my part to help in any way, knowing Kim through Medicine Forward, conversations like this, I'm glad to do it. For fun, I've got three sons. They're all grown now, and my husband and I are busy with enjoying the Pacific Northwest this summer. So just a beautiful place to live.
Well, thanks. That's awesome. And you're both doing a phenomenal job in this space. And that reminds me, if you're both familiar with this book by Simon Sinek, someone recommended to me, Start With Why. So that's exactly what you spoke to, and it's a great book. And so let's see. So our first topic was going to be about burnout, rust out, and moral injury. And there's a lot of talk about it at the physician level. But there's also, in our conversation, we talked about there's individual levels, team and organization. I think it's important to spotlight. And also, I hadn't heard the term rust out until I interviewed Dr. Sally Hambley and Dr. Claire Davies, both from the UK. And I think that term is a little more common out there, but it's basically chronic boredom due to unstimulating work. That's the quickest way to summarize it. So Wael, would you like to speak to this?
Sure. And plenty of people have spoken about burnout in physicians and in healthcare in general, and I echo all of that. I think one area that's less spoken about is how every group feels like they're isolated in what they're suffering, what they're going through. And if you speak to residents, they will tell you we're the worst group there is. If you speak to physicians attending in their early career, they tell you the early career people are at a disadvantage. Late career people think they are at the most disadvantage. This topic is so prevalent and across so many groups that if we actually took a step back and looked at everybody, a lot of us are suffering through the same things. And I would like to kind of blend the borders a little bit between these two groups, because once we can collaborate on multiple levels, then a solution becomes a lot more attainable. Whether it's physicians at whatever career, trainees, students, aspiring physicians, administrators, ancillary staff, all of that matters. Even corporate employees, because you see this big divide between physicians as employees and then their employers as a C-suite and as businessmen and businesswomen. And you feel like there's no connection there except for how can we make you generate more revenue? And that's not a healthy relationship, definitely. But also, these people are burnt out on the ground. Those people are burnt out in their offices, and there's just no crosstalk between them. And I think we should highlight that a lot. And I know from what Lisa does that she travels that gap between the two groups, and we really need to be talking more about it.
Sure, and I'll have Lisa speak to that directly. But what you said just made me even think my daughter's a few years out of college now, and her first job was with an insurance company. And even her, she would see she's a data analyst, but she could see the company is about the bottom line, and say she could see how, being a young person with a new car and needing car insurance, she could even see like some direct conflicts. But well, this isn't the best for the customer, but trying to balance that with what's best for the bottom line. So it affects more than we might first come to mind. But go ahead, Lisa.
Absolutely. And the more divided we are, the more we demonize the other group, and we shouldn't be doing that. We should be looking at our strengths in each other, and then trying to kind of come up to solutions that work for both. And I think we do have these solutions. We're just not invested enough in trying to find common ground.
Mm-hmm. I really like what both of you are saying, and one of the things in my experience, I served as chief administrative officer for the medical group for Providence's Oregon region for a number of years. And really this topic around burnout and the tension with productivity, this is something that I know that physician leaders, administrators are grappling with. And I've come to kind of appreciate that it's really looking at it at multiple levels is really needed. There's the individual level, like what can I do? To try to find, some sort of way to cope with stress, individually. But then what about my team? What's the culture in my team? What about my unit, my business unit? What's the culture there? And then some of the work, as Kim and I have gotten to know each other with Medicine Forward, is, well, what nationally is happening, and how does a little bit of effort in any of those categories really help to kind of create an environment for myself, for the people I'm working with. That's one way that I look at it, because there's no one solution to this. Like you're saying, Wael, it's so complex. And maybe, Wael, what you're saying too is, much as Kim and I are experiencing in some of our Medicine Forward conversations, I'm curious about really the emergence of relational leadership, as people are talking more about that. If we can just get back to a human connection, like all of the AI and the technology and the solutions, are great, but it's truly in how we connect. And Kim, you're masterful at doing exactly that with these kinds of conversations. Like, how do we pull at our heads and our hearts here to really think that that's the fuel to help us chart a better course for the future. Yeah.
Definitely.
Go ahead, Wael.
Well, I was going to say also, obviously, everything I'm talking about is my own personal opinion, and I wear multiple hats in multiple places. I have a business hat, and I have a leadership hat, and I have a clinical hat, and I have a research hat, and all of those things. And I see the intersection between those different venues. And from my job, I can see that I'm where the tension is in all of these groups. And I can also see that where there's potential hope for connection and for all of that. So, for example, when we talk about staff shortages, whether you're a physician or a nurse or an administrator, there's staff shortages across the country. The solution isn't we're short on staff, let's pick up extra shifts by the people who are already working. And the solution isn't either that we get AI to help us do more so that we can get the few people that we have retained do even more work. There has to be a way that, and there are multiple examples, hopefully we can get to talk about them. There are multiple ways where we can use the strengths of the technology and the people who are staying because they're staying for a reason, not just because they want the paycheck, and the skills and expertise of everybody to try to make this a lighter load on all of us.
Yeah,
and this conversation is one way to do that.
Right, absolutely. And before we get into some of those points, if Lisa would like to speak to pushing productivity versus appreciating the shortage and the value.
Yeah. I think this is an interesting, as you're saying, Wael, around supply and demand, workforce shortage. Where I sit within the Providence Health System, as well as working with other organizations around the country, Cook County Public Health, Bon Secours Mercy Health, the Queen's Health System in Hawaii, between those organizations and a pipeline of physicians and nurse practitioners, advanced practice clinicians, sitting at that intersection, it's really interesting that we are seeing more emphasis on culture mattering. Yes, compensation is important, but there are surveys showing that compensation is kind of moving to number 2. Culture matters. And I'm curious what impact that will have on organizations to really reckon with that question of creating an environment where a physician wants to be, is feeling heard, is feeling empowered, that there really is a sea change there and something has to happen. I mean, we're also seeing increases in locums expenses of, and that's not good for communities, the cost or just those temporary clinicians kind of plugging in, like, how do we really, there's a forcing function here, I think. And, some of what I've experienced is that when productivity is balanced with actual investments in clinics at the teams at the clinic level, having conversations about their experiences, that helps productivity, that improves patient experience. There are ways to tackle that. Little glimmers out there. None of it's the silver bullet, if you will, but opportunities. And Wael, I'm super intrigued at the multiple hats you do wear. I do think your perspective is really interesting about, so given that, I wonder kind of how you're tackling things too.
I'm trying to tackle things.
Yeah.
I can tell you that much. My clinical work is the major chunk of what I do. And then I do clinical research, which I try to give it its own time. And then I'm also on a leadership panel for my employer, because I work for a company called North Star Anesthesia, and that's a national company that provides staffing and solutions to clinical sites. So they employ anesthesiologists and CRNAs. So I'm working with them on the leadership aspect of things. And then I have my own business that I'm running, that I'm trying to do medical innovation. And I'm in that pocket, I see the interaction between industry and medicine. It's all very interesting. It's all, though, a bit much to kind of put in one bucket. So you really do have to tackle them as separate things and then try to find where they intersect and then try to go into that intersection and try to expand them to get more overlap between the sections. So for example, I'm doing clinical research. If I suggest to anybody to be on board with me to do research, the most common answer is, I don't have time, I'm doing too much clinical. But then research is supposed to be an improvement to your clinical work. It's supposed to give you better answers, it's supposed to give you a chance to influence the medical practice and enhance it. So I would argue that it should be part of your clinical work than just a separate hobby thing that you do on the side. And when I talk about leadership, everybody's saying we're too busy, we're too burnt out to think beyond this, to go outside this box and actually put more effort into trying to manage other people. But again, this is, you're changing or creating or managing a culture by being a leader, and you have a big opportunity to make it better. Same thing with business. There's this whole industry is the devil and then medicine is the saint. And it's not. It's really, there's a lot of intersection that we can work on, where we can have industry support medicine, and we can have medicine get the best features of industry to help. And the Sunshine Act and all these laws, and what physicians are very hesitant to accept a sandwich from a sponsor, and it's becoming too divisive, and it shouldn't be that way. So that's where I start seeing these patterns. And when you've done it for a long time, you start noticing these things a lot more. Hopefully I can use all of this to impact any kind of difference.
And I'll have Lisa speak to that, but a couple of things that brought to mind is trust along with culture, right? And I think what we were just saying, it speaks to trust has eroded in many different areas. And even I remember, I think some local nurses during the pandemic, it was kind of, I guess, that a thought, a blessing and a curse to have like locums people, right? Because it helped them out, but then they were making so much more. They're doing the same work, and then there was like the difference, the huge difference in what they were getting paid. And I think then that can also lead to a lack of trust, even amongst, like any specialty, like within nursing, etc. But go ahead, Lisa.
Yeah. No, if I'd like to talk a little bit more about that example I was providing about a study that we did with our outpatient clinics for Providence in Oregon. And we were fortunate to have a physician leader who was guiding us through a compassion initiative. And ultimately, we ended up having two different groups, an intervention group and a control group of a group of clinics. And for the intervention, it was carving out 1 hour every other week for the clinic team to have a particular conversation with a curriculum for the MAs and the front office staff and the physicians. And, in the office, it wasn't just time. I mean, sometimes you see literature saying, physicians need just time away, in order to recharge. But what we found too is how you fill that time matters, so that teams can build trust, like you're saying, Kim. And what we found was, that connection, that sense of collegiality, just with 1 hour every other week, that makes a difference. And it's what conversation to have. And let's be honest about how we're feeling around a difficult patient or a new initiative or, other pressures. But how do you create that sense of team or trust, as you said? And we did see better outcomes. Patient experience, productivity went up, access went up, 1 hour every other week. And that's just, that continues to just be a foundational kind of experience for me, to think that a little change can make a big difference. And so, Wael, it's like you're saying, all the hats you're wearing, but a little change, how do we get, it's that ripples of change idea that we know from Dr. Todd Otten in his book, that really inspires me. Yeah.
Absolutely. So one of my doctors in one of the healthcare systems said they started this program, and I think maybe it was once a month they would have a dinner with a certain topic. And like you're saying, it was, how to deal with certain patients, or because you'd think, oh, they don't want another dinner meeting or something like that. But if you have time for true, deep listening and conversations, then you feel supported and it fills your cup. And it's all about, making these connections and having these conversations. And he was willing and happy to do it. And I'm also wondering, maybe from both of you, how widespread you think that would be for systems to say that, oh yeah, we can give 1 hour every other week to do that. Like it seems like that's an unusual circumstance, but I fully appreciate what you're saying, Lisa.
Mm-hmm.
I entirely agree. And it's not just that you need, the time is 2 hours a month. So in terms of strict cost of the time, that's not much compared to the, I don't know how many hundreds of hours the people are effectively doing. Also, you don't need somebody to be an expert on managing these conversations to let them happen, because you can just put people in a room and then the conversation will organically develop. Because this might be one of those barriers that people feel, okay, so we're gonna sit together and nobody's gonna say anything, and that is rarely the case. You just need to put people together, even if they're just commiserating. It will come out with something good, because at least things are coming off their chests and they're trying to find points of unison and points of common impact and points of potential benefit to the group by discussing these things.
If I could say something quick, and then Lisa, to speak to that, is we have Medicine Forward open community gatherings every other Monday night at 9 o'clock, and I've attended a number of them, and it speaks exactly to what you're saying, Well, and it's kind of like the people that showed up or the people that needed to be there, and there's someone who can frame like a topic or something, but sometimes not, and each single gathering has gone in totally different directions, but it was very fulfilling for the people that showed up.
That's great. Well, Wael, I'm wondering too, what you're seeing kind of coming up in the ranks, of this, what you're noticing. I mean, I of course have my eye on residency programs, fellowship programs across the country, what they're seeing. But I wonder, kind of from your vantage point, is there, what opportunity is there with this sort of next generation? Do they have a different sensibility, or how has your mentorship of them shifted or changed?
I think there is a change, and I think that change is expanding. The situation I'm in is a little bit unique because I work in an academic center where the anesthesia division is managed by a for-profit company. So that's not the usual structure. Usually it's an academic center. Physicians are employed by the hospital, residents get into the hospital system, and then they're their own thing. And then they finish, they go and they get employed by someone. What's happening with my employer is a little bit different, because now it's the same company that's employing, say, ambulatory surgery centers and academic centers and private centers at the same time. So they can't have the same culture in all of the sites. And they kind of have to adapt to the different cultures and try to find a common medium between them, if that's even possible. But there's a lot of conglomeration of anesthesia practice specifically, and I can speak to it just because I'm in it. A lot of the smaller practices are becoming joined together under a bigger umbrella. A lot of the academic practices are joining those ranks as well. So now you have this mesh of for-profit and academic and private and all of that at the same time. And with all the limitations, with everything that's going on, I think I am fortunate to be in a company that's looking into that actively. So for example, when I joined, I told them for me to be happy in a job, I need to have a research position. And they had no such thing, because for-profit organizations and private organizations don't really do research. But I come from a research background. So I told them that's what I wanted. They created the position for me. It's the joy of choosing what I do is something else, but also the headache of creating something new is something else. But then at least somebody is listening to what I'm saying, and somebody's saying, okay, if this is what's going to make you fulfilled, let's do it. And we see the value in it too as a company, because now you're going to attract like-minded academicians. So when you have somebody at a power position who's listening to these on the ground concerns and doing something about them, no matter how small or how slow the progression is, it changes the culture. And that's the reason I stayed with that site. Even though I had the option to go multiple other places. But as you were saying, both of you, the culture makes a big difference, and people are realizing it more and more. And I think eventually this model should and probably will be copied into other places, and then it will become more of a movement than just a one-off.
I just quickly want to say is we were just at a Medicine Forward meeting a couple hours ago, Lisa, and one thing that came up, and I'm going to share it here, it's kind of what you're saying, I think like doctors have more agency sometimes than they think they do. And what Dr. Michael Hirsch has shared is when physicians either ask for things the way you did, Wael, or set boundaries, that they force the systems to change along with them. And I think that's what you're saying, right? Is you're able to, the system is adapting to some input from you.
And on the flip side of the coin, it doesn't have to be a confrontational change. It doesn't have to be that you either do this for me or I leave. It can be, let's find common ground and let's work towards a goal that benefits both of us.
Agreed.
I love that. So Lisa, if that brings anything to mind, or if you guys wanted to each speak a bit to the role of AI in technology.
Mhm. I think for me, I really appreciate, Wael, your perspective of every culture is different, but there are some, like, if we could get to some of those core principles of and role modeling that. I mean, I think I put that as a priority of active listening, you know, creating a space to listen to others' opinions. And what I really like, Wael, about what you're saying is a sense of possibility. You said, I'm interested in some research, in doing research, and the organization heard you, just as you're saying, Kim, like that sense of possibility. I mean, I think that's what fuels me in a lot of my work, but I think Wael has something to say about AI. I'll let him kick that part off.
I will keep it very brief. It's my specific viewpoint on AI is a combination of a lot of things that you're hearing, but also if you look at social media and all the content creators that do anything around AI, whether medicine or not, the overarching theme is we're gonna get AI, it's gonna do most of what you're doing right now. And people are interpreting that either as, well, great, now I get the chance to do more things, or not so great because now I'm gonna have to do more things, or this thing is gonna replace me and I will be out of a job. It doesn't have to be either one of those, because you can get technology to help you with some of the things that you don't need to be spending so much time and effort on, so that you can focus on the things where you excel and where you're unique. It shouldn't be an excuse to say the solution to physician shortage, for example, is to let AI handle some of those jobs and then throw more stuff at them. That should not be the goal, because then your physicians will resist AI. Same thing for administrators, same thing for C-suite, same thing for anything, businesses. There is a Goldilocks region within AI and within technology, and what we can use it to, what we can use it for. For example, use AI to recognize your employees. And I was fortunate enough to work on a chapter in a new book that should be coming out soon, where we talk about how we can use AI, how we can leverage it to recognize employees and honor their achievements and push them to kind of be productive in their own unique ways. It's very easy for an AI system to see patterns in an employee's productivity and focus on the things where they're really unique and they excel at, and just boost those. Give them more training on there. Put people together to form efficient teams, but just don't make it as this is either going to replace you or it's going to make you work even harder on other things. That's the little silver lining there.
And just briefly, from my perspective, it's curious to observe that as there are more technology solutions like AI, we are seeing models in psychology or leadership also evolve to center on connection and relationship. And so while we have more technology, we know that to engage and motivate and inspire, you know, we have to lead differently. And so maybe there's a corollary there. And just in my own definition, just a sweet spot, you know, close to my heart. When I think of AI, I also think of appreciative inquiry, which is that approach to how to have conversations where we're talking from a strengths-based orientation about what's possible, because at the same time, there's many things coming at us. There's just incredible potential, and how to have a conversation matters. And so, you know, just at the work that's happening out of Case Western Reserve University and Dr. David Cooper Ryder, that's the other AI, the appreciative inquiry AI, that maybe is a good complement to all of the technology solutions we're seeing right now.
So I love that. And as we're winding down, we always want to include our reasons for hope and inspiring initiatives. What would you each like to share?
Reason for hope is there are people like you and like everybody else who's trying to make this work and was trying to find the best aspects of everything that we're doing and getting together in groups. Medicine Forward is one, and there are multiple others. If you look hard enough, you will find common grounds between any and all groups. And all you need is for people to really want to explore those common grounds and get the best out of them.
I like that. Agree. And I think there's something too, I mean, I know with my own sons or their friends, like this next generation, I really am curious about kind of what's emerging and remain feeling a sense of possibility. Of course, it can feel overwhelming of everything happening in our country and in our world and in healthcare, especially after last week and various IT meltdowns and other things. And yet, there's potential here. And so I think it's finding that for myself and how can I help my teams, and in conversations like this. Super appreciative, Kim. I mean, you are unique in your ability to get to the heart of this, creating relationships and a sense of possibility just in these conversations, as you said, Wael. So thank you so much, Kim. Really appreciate it.
Well, thank you. And I love the work that both of you are doing. And then, as we know, we're working and with the Healthcare Reinvention Collaborative and becoming a network of networks. And there are a lot of people doing good and interesting things out there. And we're just trying to find them all and connect them all. Everything from nurses reinventing healthcare to primary care for all Americans, Doctors for America. So we're just trying to find all these pockets of what's working, and we're all going to make a difference together. It takes all of us, right?
Yeah,
Absolutely.
for sure.
So, well, thank you. So as we're starting to wind down, I was going to ask you each if there's anything else you'd like to share, any top tips for your colleagues. I know, Will, you might have some wisdoms to share on like emotional support, self-improvement, overwhelming effects of fear of missing out.
Yes. In a culture of a little too much social media sometimes, you look at content creators in multiple fields, including healthcare, and the main drive is to create more content and put it out there to get as many clicks and as many eyeballs as possible. That sometimes translates to, I will sell whatever sells, which is not always a healthy thing, whether you're doing social topics or health topics or medicine or anything. It's easy to get absorbed into this whole whirlwind of, oh, this person said that and this person said that, and then it becomes so confusing that people tend to just give up on everything because it's too much. I want to say, keep yourself centered, whoever you are and wherever you're working. Don't feel like you have to be catching up with everything, because there's no possibility you can catch up to everything. Even if you look into one specific niche and one specific topic, there's so much out there, and things are changing by the day. So don't let that be your compass. Second thing is, emotional support is absolutely crucial. And I know a lot of institutions, a lot of organizations are focusing on that now. And for everybody, don't feel like you're the only person who's burnt out. Don't feel like you're the only person who's the victim. You are a victim of something, but you're not the only one. And feel for your colleagues and for the people you work with, and they will also want to feel for you. My timeless advice is always just get people together rather than silo them each to their own section. And just pursue self-improvement, but not at the expense of denying other people what they're doing. If you want to advance, that's perfect. If you want to climb the ranks, that's great. Don't do it at the expense of somebody else, because you rise and you can let other people rise with you, and then you can make much better good in the society. However attainable or not that is.
Well, thanks. Well, I love all of that, and especially granting the permission not to know everything and learn everything, because you can't.
Yeah.
Right. Mm-hmm. Thanks. What would you like to add, Lisa?
I think what comes to mind for me in this conversation is a little bit of like, find your people. I mean, this is where Wael, we met once before, and yet I feel a sort of collegiality with you that helps me in my work, to feel connected. And Kim, of course, of this time knowing you, find your people, and they're out there, and it takes a while, I mean, it doesn't just happen to just feel, whether within your organization, your community, or there's so many things going on across the country, as you said, Kim, just there's a real sense of possibility there. So thank you.
Well, thank you very much. And when I had Dr. Gabe Shervano and Denise Weissman on here, and we talked about it, and they said we're doing it just by having that conversation and just by having this conversation, we're doing it. And I just think that's awesome. So thank you both again for being my guests. I love this conversation and I can't wait to share it with everyone.
Thank you, Kim. Thanks, Wael.
Thank you for making it happen. And listen to this. So what we're doing is going to lead to something good, whether we do it personally or somebody gets inspired and does it. And that's all because one person who's Kim got one other person and one other person to talk together and just post it somewhere. And it's doable. It's really doable. It's just we need the people to do it.
Agreed.
Yeah, you're exactly right. Thank you so much. So in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Love that. Thank you.
Thank you.
Thanks.